Hello everyone, this section we will study the point about cancer therapy, part 1. The most common treatments for cancer include surgery, chemotherapy, and radiation. Surgery can be used to take out the cancer. The doctor might also take out some or all of the body part the cancer affects. Surgery is not used for all types of cancer. Blood cancers like leukemia are best treated with drugs. Chemotherapy is the use of drugs to kill cancer cells or slow their growth. The drugs can be small molecules that enter a cancer cell and work by targeting a specific substance inside the cell and blocking it. Large molecular drugs usually can't fit into a cell. They work by attacking, then weakening or destroying proteins or enzymes on the surface of the cell. Radiation therapy kills cancer cells or slows their growth at high doses by damaging cells' DNA like getting an X-ray. Sometimes it's given by putting a seed inside the cancer to give off the radiation. Radiation therapy doesn't kill cancer cells right away. It takes days or weeks of treatment before DNA is damaged enough for cancer cells to die. Traditionally, the primary purpose of cancer surgery is to cure your cancer by removing all of it from your body. The surgeon usually does this by cutting into your body and removing the cancer along with some surrounding healthy tissue to ensure that all of the cancer is removed. Your surgeon may also remove some lymph nodes in the area to determine whether the cancer has spread. This helps your doctor assess the chance of your being cured, as well as the need for further treatment. Anesthesia keeps you from feeling pain during surgery. Other techniques used in cancer surgery include cryosurgery. Very cold material, such as liquid nitrogen spray or a cold probe, are used to freeze and destroy cancer cells or cells that may become cancerous, such as irregular cells in your cervix. Electrosurgery. By applying high-frequency electric currents, cancer cells, for example, in your mouth or on your skin, are killed. Laser surgery. Beams of high-intensity lights are used to shrink or vaporize cancer cells. Mohs surgery. Remove cancer from certain sensitive areas of the skin, such as near the eye, by removing cancer layer by layer with a scalpel. After removing a layer, it is evaluated under a microscope, continuing in this manner until all the abnormal cells have been removed and the surrounding tissues shows no evidence of cancer. Laparoscopic surgery. A surgeon uses a laparoscope to see inside your body with several small incisions, and a tiny camera and surgical tools are inserted into your body. The surgeon watches a monitor that projects what the camera sees inside your body. The smaller incisions mean faster recovery and a reduced risk of complications. In robotic surgery, the surgeon sits away from the operating table and watches a screen that projects a 3D imaging of the area being operated on. The surgeon uses hand controls that tell a robot how to maneuver surgical tools to perform the operation. Robotic surgery helps the surgeon operate in hard-to-reach areas. Natural orifice surgery is currently being studied as a way to operate on organs in the abdomen without cutting through the skin. Instead, surgeons pass surgical tools through a natural body opening, such as your mouth, rectum, or vagina. The reasons you might undergo cancer surgery include cancer prevention. For example, someone can go double mastectomy if her family tree has warranted genetic testing for BRCA mutation, which have been found out 87% of risk in developing cancer. The mastectomy can lower this risk to under 5%. Diagnosis. The cancer surgery is to remove all or part of a tumor, allowing the tumor to be studied under a microscope to determine whether the growth is malignant or benign. Staging. Cancer surgery helps to define the cancer stage, which makes it possible to evaluate the size of the tumor and determine whether metastasis has happened. Primary treatment. For many tumors, cancer surgery is the best chance for cure, especially if the cancer is localized and hasn't spread. Debulking. When it's not possible to remove all of the cancerous tumor, as much as possible tumor can be removed in order to make chemotherapy or radiation more effective. Relieving symptoms or side effects. Sometimes surgery is used to improve the quality of life rather than to treat the cancer itself. For example, to relieve pain caused by a tumor that's progressing on a nerve or bone. Risks of surgery include pain and infection. Other risks of surgery include bleeding, damage to nearby tissues, and reactions to the anesthesia. This is the end of this section. Thank you very much.